Okay, we're here for part two of working on elbows. Okay. This, what we're going to want to give you now is a couple manual techniques in that a person can use on themselves for elbow pain. It can be used for tennis elbow. It can also be used for other types of elbow pain that you have. And benefit of it is that you can do it on your own. You don't need any equipment or anything to do it with. Me and Brian would like to show you a couple techniques to do. Okay. First, what I want to show you is you're going to bend your elbow. All right. So we're going to show it on Brian's right elbow. What he's going to do, then he's going to take and he's going to feel the little knobby here on the inside of his elbow. So that bone right there. Okay. That's his landmark. So he's going to slide his thumb down about its own width, just off in that bone. Okay. He's going to reach over the top of his floor. Okay. And then what he's going to do, a kind of a mild grip, he's going to turn his palm down. Now, from there, then he's going to, pushing through his thumb, support himself, he's going to push out to the side. So he's going to get a gentle pressure of about 10% of an effort, but just pushing out to the side. And from there, he's going to make a grip and release. What I meant to tell you first, check the grip first, see how painful it is. Okay. And if it's painful, then you add this technique. And then as you're holding that pressure to the outside, then re-grip and see if that you can't grip harder with less pain. Because a lot of times just that little mobilization there at the elbow can reduce that. A second movement you can do is the same way. If it bothers you to bring your wrist up and down, go back into that position, like Brian did, push out to the side, and move your wrist up and down and see if it's not better. Then you can release. So that's one technique that we call a mobilization for the joint. A second technique is, again, you're going to take your hand over the top of your elbow. Okay. You're going to use your index and middle finger. You're going to find the knobby bone on the outside of your elbow. You're going to slip down about 2 fingers width. As you come off that bone, you feel a little groove, and then down just a little bit farther, so about 2 finger width, and you'll be on top of your elbow. Right. Okay. From there, then you're going to do a gentle grip with your index and middle finger, pushing into that bone there. Then you're going to turn your palm up and down as you maintain that pressure at your elbow. Again, it's a mild pressure, but this is another way to mobilize that elbow. And so you could do it palms up, palms down, checking it if it was painful before, and then if that makes a difference on your aim. You could do it with gripping. If it was painful before, see if it changes your grip. And you can move it up and down. So again, testing for painful positions and then seeing if one of these 2 different mobilizations at your elbow would help make the pain better. If it does, then that's what you want to keep doing. Third one is some soft tissue work. You can get in there where it's tender and do a gripping technique or pressure techniques, but just getting in there and working that, not to see how much pain you can tolerate, but just to loosen it up and then pin it and move your arm or wrist up and down as you try to release that. Some soft tissue techniques, you could roll it, you can use balls, anything to get in there for the soft tissue. So we gave you a couple movements for the joints themselves and then some soft tissue work. If you have further questions, contact us at Fitness4Life PT.com.